For a patient. The patient follows just behind. He has removed his belt and is preparing to use it as a potentially lethal weapon. He strangles the nurse, causing serious injuries, including perforating both eardrums and injuring his neck and eye. Nurses are angry about the attack and say there have been others. They say they warned the hospital that staff cuts were putting them at risk.
Well, this has been building up for at least 6 months. We wrote to the Trust on 3 previous occasions saying that the cuts in staffing levels on nights was unacceptable. The wards here are very busy, they're very acute, the dependency levels of the people here are very high.
The patients in this centre can be among the most dangerous that any hospital has to deal with. Their behaviour can be unpredictable and so can their numbers. They're often referred to the centre from accident and emergency, and it's impossible to predict how many there might be at any one time. Nurses say the centre can be so full patients have to sleep on sofas. 2 staff, they say, are on night duty, sometimes looking after more than 20 patients.
We have overcrowding, too many patients, and we have understaffing. That affects everything else. It affects the quality of service we can provide. It affects our morale, and it is also dangerous.
Nurses report being punched and having their hair pulled out. Another attack particularly appalled colleagues.
There was a young lady who I was at a meeting at, and she described that, she told us that she was restraining a patient, and while restraining this patient she got kicked, and as a result of that she'd had a miscarriage.
More staff say the unions would give greater protection to nurses if patients turn violent. They also complain that alarm systems are inadequate compared to some other London hospitals, making it difficult for nurses to call for help. The Hospital Trust says it's looking at both staffing and the alarms. Phil Bales, London Tonight, Hackney.